Hi, everyone.
Okay. So, welcome to God Talk. And I'm here with Carol tonight. Carol's a doctor on call. So we're gonna let her uh, be with us in conversation, and hopefully she won't get called away, but it's very possible. So we want to just thank you for still being here and taking part of tonight's conversation. So I'm going to ask uh, an icebreaker question, and you can elaborate on it as little or much as you want. And so you're just your name, your pronouns, and where did you grow up? So, and
Oh,
Reverend Mona, you go first.
Okay, she, her. I grew up in Houston, Texas, on the north side. I went to Sam Houston Senior High School. Go, go Tigers!
What part of town is that?
It's on the northeast side. It's right off 45, off Parker and 45.
Okay, I know exactly where that is. Okay, so we'll go in order of the screen. Krager, can you tell us who you are and where you grew up?
Prager, my pronouns are he, they. I spent the first 10 years of my life in Wisconsin on a dairy farm. And and then my parents moved us to San Antonio, Texas. What a culture shock that was.
Yeah, I bet.
Bro, mama, you got a mookie, I can go, got you. Yeah. Is
Yeah.
that was that it? Like
And how old were you when you moved to San Antonio?
I was 10.
Wow, that's
Well, and then if you want to go till I was 18, I spent most of my teenage years in a motorhome with my brothers and sisters and my parents because we had a family band. And so I was in the Partridge Family or
Wow.
the Jackson Five, except not famous and not on TV. But we tried, but we didn't quite make it.
Yeah.
what was the name of your band?
The Calson family.
Okay, duh.
Wow. What?
Nice.
Okay, Carol and Marco, tell us about
Okay.
you.
Um, I I'll go first, Carol, she, her. And I was born in Lubbock, and then we moved to Michigan, then San Antonio, Texas. And then we moved back to Lubbock when I was in third grade, and that's when my mom said that's when I started rebelling and that I didn't quit until I left Lubbock. And so I think that's very true. I was not happy with that move. And uh Marco,
Thank you.
you're he him.
I go take a key back. I go take a key back. I'll take a key back.
King Marco, excuse me. And where did you grow up?
I go.
That's where you were born. You were born in Peru, in Lima, Peru, and you came to Amarillo before you turned 3. And
Yeah, I take a
so I would say
cookie.
more of your growing up was done in Amarillo than in Peru.
Yeah, I got back. I'm back in back. Okay. Be back. I can go.
Yeah, he helped a lot with the football team in Bushland, Texas, because we lived in Amarillo, but we were in the Bushland School District.
That
So,
sounds fun. That sounds fun. Well, welcome, Carol and Mark. And then we
sure.
have Monique. Monique, tell us about you.
Oh, um, well, I'll make it quick. Well, I was born at Fort Sam Houston Army Base in San Antonio. All y'all came up there and I started out there. But anyway, so from there we traveled all over the world military. The farthest place we went was Okinawa, Japan, back to California, and then Dad retired back to San Antonio. So how I got to Houston was coming to here to go to college. Oh, and
Okay.
my pronoun, My pronoun is I just realized I got a she and a they.
I like it. Okay, and I'm Suzette, and I'm a she, her, and I was born in Brooklyn, New York, and so I have this like dual personality. I have the Brooklyn girl, uh, and we also moved to New Jersey when I was 3. So my Brooklyn family, my Jersey girl persona, the tough girl. And then when I was 14, we moved from New Jersey to Texas, and it was traumatic for me. Um, I went to Cypress Creek High School in Houston. It was a brand new high school. We were the first graduating class from that high school that went there all 4 years. So
Stop it.
while it was culture shock for me, I'm really glad that we did move because it gave our family time to be okay. We had a lot of upheaval going on at the time, so parents were divorcing and all that stuff. So, but anyway, I'm happy to be in Texas. I claim Texas as my home, and but I love the mountains. So again, I'm going to go see Carol very soon. When I need a break, I'm gonna come see you. So thank you all for coming tonight.
Trigger had his hand raised.
Okay,
I had a
what's up?
question for Carol, which was, did you like that song? I thought happiness was love of Texas in my rearview mirror.
Yes, I sang that all the time.
Mac Davis. I don't even know what year, 1970 something.
What was that?
I don't know what year it was. It was like 80s, maybe 70s, 80s. I can't remember.
I knew it well, I think, by the time I left Lubbock, which was in, I guess 79. So,
And where did you go to school?
Me?
Yeah,
Monterey in Lubbock.
Monterey in Lubbock. Okay,
Oh,
interesting.
and yeah, then I left Lubbock. I didn't go that far though. I went to Canyon to go to college.
A lot of times we stay close to home. I didn't stay real close, but I didn't go far away either. So so we try to think about topics that are relevant to all of us and things maybe we're struggling with and how that connects to our faith and our spirituality. And part of our faith and our spirituality is also our health. Our health is the foundation for what we can do in life and how we feel and how we feel about ourselves, our mental health, our physical health, our spiritual health. So um, a few weeks ago, and I'm backtracking because I'm a proponent of I work with an organization, the National Federation of Business and Professional Women's Clubs, and it's a national organization. It's 103 years old, and um, we look for ways to lift professional women up because there's always been some gender disparity, inequities with pay and all kinds of other stuff. So it's just an organization that lifts women up and tries to help them, do better in life with resources. And part of what we're doing is we have a healthcare arm of the organization, and Saturday, I'm going to be representing them as their public relations chair for at the conference called Heart of a Woman, and it's being put on by Methodist Hospital, DeBakey Heart and Vascular Center, and it's a bunch of doctors that come together and talk about healthcare for women, but with regard to heart health. There's been a lot of gender disparity in heart health care. And I just thought outside the box about, what does that look like for us in our community with our our different gender identities and, how the outside world treats us. And so my big question tonight is, are you out to your doctor? So I had an experience about a month ago with a doctor and her staff. And I specifically picked a female doctor because she's an OB-GYN and that was my preference. And just to make, to kind of give you the story in a nutshell, I was having a non-medical procedure. I have hormone optimization therapy stuff going on, which has helped me a lot with my personal health, and how I feel. But she made one of the prerequisites of getting this hormone optimization therapy was getting an ultrasound. And it was a vaginal ultrasound, kind of, TMI, but I have to tell you the story or you won't get it. So I was sent in her office to have this procedure, and it was done by a male technician, which I wasn't I wasn't asked if that was okay. I wasn't asked if if I wasn't given the choice of did I want to have that or not, or was it, at that moment I had questions that I didn't ask. And at that moment, I felt like I was doing something against, what I normally would do in any situation, and that would be, you know, in that situation. So I didn't say anything that day, and I went through the process of, got my hormone optimization for a year, and then a year came up and it was all about uh, you have to have an ultrasound. And I said, not doing it, not having the ultrasound this year. And I told them why. And they didn't offer me an alternate, like, okay, you can go to another facility, or, or no one talked to me. So I felt, um, I felt like the whole process was horrible. And I felt like I got PTSD over the whole thing because it was something that I wouldn't have chosen to do ever. Um, and so she refused to see me again until I did this procedure. So that made me think about the bigger question of the LGBTQ community. You know, are you out to your doctor? Are you able to talk frankly with your caregiver about anything? And does, have you been in an instance or a situation where you felt like that didn't work for you, or it was not a good situation? It felt like discrimination. It felt like bias. Um, and then towards the end of our conversation, maybe some resources that we have for ourselves to find those quality care doctors that are gender affirming and, who understand our community and, what it looks like. And then some suggestions for, where we could maybe point that doctor. Because I'm going to go back to my doctor and say, I think your staff needs some sensitivity training. I think that the gatekeeper to the doctor who was making me go do this procedure, I was like, well, isn't there an alternate here? Nope, can't you, either you do this or we won't see you. And I was furious, and I almost walked away mad and just said, I'm going to find a different provider. And it would have kept me from having the opportunity of talking to this doctor about how I felt and telling her how her staff made me feel, and educating her that not everybody is like you, in the world, and how to give a better quality of care to a diverse population of patients. So that's it for tonight with my idea for the conversation. So, and Craig has his hand raised, so I'm gonna let Craig say stuff.
So in your case, was it, I mean, this doesn't necessarily sound like, a specific LGBTQ issue. Maybe it was just you're a female patient that doesn't want to have a man, doing any kind of procedure, and it not having anything to do with being lesbian, right? Or
Right. But there's more to it than that, There's other people who maybe have had, um, you know, abuse or trauma in their past, and they don't want to be touched by a man, that kind of thing. So it's a bigger question than that, too, in my opinion.
well,
But
it's easy to find a gay male doctor in Houston. So I
so
have
how
two,
would someone do that?
huh?
How would someone do that?
Well, I met both of my doc. Well, the first one I met just through a friend, not even anyone. I wasn't even at Resurrection at the time, just a friend I had. And so that doctor was, somewhere in the medical center. And so I stayed with him until he decided to go into like plastic surgery and stuff. And then he referred me to another doctor. And so I had two primary care doctors when I was in Houston that were, that were gay. And so there was no issues there. But um, since I've been in Austin, you know, it's been a little bit different. I mean, first of all, when I walk into the room, people just know I'm gay. I've never been able, people just know. So there's no point in me, trying to put up a facade or hide anything about it. But both my cardiologists that I have, they know my story, and they know I'm married. And so far I think Austin is kind of I'm going to one of the bigger, groups of cardiologists and specialty care. And I think that when you get involved with a larger group like that, there's more, and in a larger city, there's more, what's the word I'm looking for? There's more awareness of different communities and how people need to be treated. And so I can't say, and for primary care, I just wind up going to like total men's health, which is, it's not a doctor, it's nurse practitioners, or I go to Medic Clinic, which is nurse practitioners. So it's very convenient. It's very convenient because you can typically get in within 24 hours, 48 hours. But I haven't made that relationship yet with a primary doctor. So I'm basically acting as my own primary doctor because, I work with medical claims, and I basically, watched what my primary care doctors did for 20 years. And now I just do that. If I think I need to go see a specialist, I don't need a referral on my plan. So I can go. But for me, the number one thing that I look for like in Austin, if I have to go somewhere, I'm looking for convenience in terms of how far I have to drive.
Yeah.
I hate driving. And so my cardiologists are only like 6 miles away, and these two little primary places I go to are less than 2 miles away. So, and then now I'm in virtual care for psychology. So, but I can't say that I personally have yet to have a problem with the cardiologists or any of the people I've seen here. But yeah, I feel awkward, because I'm different, I'm in the 10% or whatever. And whenever you know you're in a group that's not the majority, and you walk in someplace, I'm going to feel awkward, and I do. And then I just wait and see, how it's going to play. But, I try to be a good patient too. I don't, you know, I don't walk in with a bunch of demands or whatever, because,
So would you feel comfortable if something was said, or something happened during a visit that you were uncomfortable with, and it leaned towards your gender identity or your sexual identity, and would you say something? That's my big thing is,
Mm.
I'm the type that I'll just get mad and walk away and go find somebody else. But I think in this instance that we need to start speaking up for ourselves, because I think it'll just continue if we don't. So,
Yeah.
but on the other spectrum also though is partnered people who maybe are in the hospital, when with aging parents, uh, two people, a couple is going to probably share that responsibility of being with a parent in the hospital, and do those hospital people pay attention to you in the right ways? It's just there's so many questions that I have that, have you ever had an experience? And um, I mean, Carol works in the medical field. So do your doctors have sensitivity training, or is there a resource somewhere that says this doctor is LGBTQ friendly? Is that something that they could even say or are allowed to say about themselves? Are you allowed to tell people that?
Absolutely. And I think that I've listened to some conferences who were put on by like medical schools and or residency groups. And so I think there is a lot of sensitivity training going on in residencies now, in OB-GYN at least. I don't know if that's happening in family practice or other places, but it certainly wasn't present when I was in school. Um, and it was just through organizations like the Gay and Lesbian Medical Association that I found out there were some like lists, and like the Gay and Lesbian Medical Association would say, do you want your name on the list, and do you have other people you'd like to suggest that you would recommend to be on the list?
Is
And
that a national organization?
um yes, I mean, at least it was in the 90s. But I think I saw it on something you sent me. So I believe it must still be very active. So um but I and I mean, like our we still have these stupid paper intake forms that are like take people like 30 minutes to fill out, and they're very cumbersome, but they do include things like um what is your like what is your gender identity, and what is your sexual preference, um and so I think a lot more offices are doing that than they used to, um, and it ask about your partner. But but OB-GYN offices, I mean, we have to do that because we're wondering about, pregnancy and contraception and all of that. And thank you.
Bye-bye.
And so I'm just not sure that that's true for a lot of other offices.
So is there a place, a website, a guide, a book, or an online resource that people can use to? I was kind of looking for one before this so I could say, The only I found some stuff on the HRC website, but it wasn't like really, it was just one of the many things instead of really focused on it. So I just
But
thought,
you mentioned the Gay and Lesbian Medical Association provider directory. I have not looked to see if that's still active, but that's the one I was referring to. The
okay.
GL. So I think that would probably be a really good resource for that. Yeah.
And
And
so putting together resources for our community, that's another reason why I was kind of trying to tackle this topic today. Is this past week we had a workshop on, or a conversation with the Houston Bar Association regarding end of life decisions for the LGBTQ community. And they were like, there's really nothing out there. They're putting a toolkit together for the community that'll be a free toolkit. And they are also sponsoring will-a-thons, which basically they give you the tools you need to put a will together. But it feels like, wow, we still don't have any of this yet. And until you need it, until something happens, you don't know where to go to find help and information. So these are just some of the resources that I would like to put on our website for people to help them when they have hard decisions or hard conversations to have, or a conversation they need to have and they don't know how to have it, that kind of thing. So, and same with mental health, we need a lot of resources that understand who we are as people and how we operate, and what's important to us. I had a client. I have lots of doctors and medical professional clients, and I had a client that I was going to do a website for, and I did some stuff for him, and shocking. He said some shocking stuff to me in his office about how he didn't want people like that on his website, and I ended up not working with him, but it was blatant discrimination. And I was like, where do I go with this? What do I do with this? How do I handle this? Where that's a doctor I know for sure is out there not doing the right thing for people. Um, so that's kind of why, I'm picking up the torch on this, because I feel like it needs more discussion. So, Mona, have you ever had an instance where you felt like, something could have been happened better for you, or you didn't get the right kind of care, or you avoided getting care because you didn't feel like the healthcare provider would have been sensitive to you?
Well, this is not a very good subject in the fact that I retired from the medical field, and I was in the medical field when medical care was medical care. Now it's a business. And so, hold on just a minute, um, so I have seen the decline of medical care, and it was only validated when I went to the chiropractor, because he was put out because one of his clients had a daughter who had an eye injury, and she was going to one of the places in the strip centers that they have now, and the strip center said, who they want to get your glasses, they want to get your money, but when it comes to an emergency, they don't want to help you. And so it's like, nope, sorry, we're busy, can't do it, and didn't offer anything. And what I've seen, and I've complained about it for a while now, is the fact that, when you choose a profession like it used to be, medical care or even ministry, you devoted your life to that. Okay, that was a life calling. But nowadays, it's an hourly calling. It's like, oh, office hours are over. I'm off the clock. you put on the recorder in 911, call 911 if you have an emergency, or go visit your local hospital. So that's where it is now. You can no longer get your doctor. There's no longer, I got one doctor left that has an answering service, that if something comes up during the night, that I could call this service, which is which is a gynecological service. And if I have a medical need, it's the only one that I can get a hold of. And fortunately, he's from an old school, so he's there to help you or to direct you. But he's the only doctor that I can get a hold of. And I am so angry that it's such a business and not a profession anymore. The same thing I have found that is turning into some minister opportunities. There are ministers who are all into the glam of the sermon, but they're not into the empathy of hospital visitation or hospice visitation. For them, ministry in their mind's eye is about sermon, and it's only that, and running the business of the church. But as far as spiritual, intuitive counseling, listening to your parishioners, that's not there. It's not who they are. And it's a growing thing that I have seen over time. So I don't have a good report on the medical care of doctors these days, because I've had to fight their book doctors, even with my own father, because he was diagnosed as a diabetic. And his doctor said, "Oh, you're diabetic? You got to be on insulin." And I said, "No, he's not going on insulin." "Oh, no, he's diabetic. He's got to be on insulin." I said, "Oh, no, he doesn't." Well, I'm not going to see him unless he sees an endocrinologist. So I said, "Fine, we'll go see an endocrinologist," which we did do. And the endocrinologist said, he doesn't need to be on insulin.
Okay.
And it pissed her off. And she left that particular practice. She went somewhere else. But it shows me that, what is being produced is doctors who say, this is what you have, this is what you do. There is no outside of thinking of the box. There's no caring or listening to the person.
Or even looking at your charts all the way through to even know what's
Right.
going on with you.
Right. And I've had them come up, and you can tell them something and they'll say, have you had this done? I said, "Yes, it's in my chart." Oh, let me see. "Oh, yeah. See, they're not even attentive.
They're not even going through it.
Right. So when you ask me, I don't have a good perspective on this, because I've seen the demise of or the transition of lack of care in medical care. I mean, when you have insurance companies tell doctors how long you can stay in the hospital and what treatment you can have, or they go into your life expectancy and decide, we're not going to value this chemo treatment on you because you're 85 and you only have so many lives, and they weigh the stats down and they say, well, you only got a couple of years anyway. So, why should we spend, hundreds of thousands of dollars to save your life when you
Right.
It's a bigger story. It's a much bigger story.
Yeah.
What do you think, Monique? What has your experience been lately? Have you felt heard by your doctors? Have you felt any kind of, you know, uh,
I
you know,
just, like just briefly
different
incident,
treatment?
you know, but I'm pretty much piggybacking on what Mona's saying. And, I thought I had found, that's why, like Mona is saying that, she has one doctor that still seems like they care. I was so beside myself when I found out that my doctor was retiring, and she was one of the few people that actually took the time to know the patient, not just like she was saying, "Oh, you got this, oh, so take that." No, she was not like that. And so anyway, I ended up finding a new one, and this just happened just recently, last month, and it's like with all the history I have, and that was transferred from the other doctor to this new doctor. She prescribed something that didn't agree with me, and that medicine had me going for like 4 weeks, and then it was going through different spikes 3 different times through the day. And I'm like, I was just so upset because she should have known not to give me that, but that she didn't take the time to read through my chart. So I'm thinking, I'm trusting her, thinking it's okay to take this, which it was not. So now it's like, I feel like I have to doctor my own self before I take anything now. So that was very, fortunately, I have a very good track record with my job, and I have a long history. Thank God I hadn't burned any bridges yet. I hadn't burned any bridges, and so during those 4 weeks, the people that work with me were very tolerant. And the manager said, "You can even work from home, if you need to." And I was just really pissed off at her because I went through this for 4 weeks to get that
Mm-hmm.
stuff out of my system. So that's my latest
Yeah.
bout with doctors. So now I'm at a point where I don't trust them now, and it's like I have to do my own research before I take anything now because they're not doing it.
So we have to be advocates for ourselves. We have to advocate for our own health care, or we have to
Yeah,
have an ally, like have our aging parents, So even though I don't really have a huge amount of time to go to lots of doctor's visits, we make sure we go to doctor's visits with our aging aunt and aging mom because we know that they may not get it right, they may not ask the questions, and especially,
yeah,
it's aunt and mom, so they're women, older women who don't have that um advocacy for themselves in healthcare. So it's a big question, and
and like you said,
I
it's
see Reverend.
pushing medications
Yes,
instead of trying to actually help the patient.
but I
I'm,
came
I'm
across
seeing that
like,
I'm seeing that it is becoming more and more like a business. I didn't want to believe that at first until I start seeing these things happening to me and other people. And I said, like you said, we're going to have to become advocate for ourselves. And I guess because the last doctor I was so trusting in her because she took time to actually know her patients. Whereas I don't want to say all new doctors, but I'm saying the doctors I'm running into now are not taking out that time to actually get to know what's going on patient health wise before they give them something.
so I wonder what we can do. Um,
I
there's
don't know.
such
This
a
is
yeah,
huge. This is
yeah.
huge. It's such a big business. I don't even know what you
Mhm.
can do. I mean,
Yeah.
some people get maybe one or two second opinions or something before they may pursue something, but I don't know what you can do. It's so big now.
I think there's a lot of merit in referrals, like somebody had a good experience with a doctor or looking at their reviews. Um, it sounds cliche to look at someone's Google review, but there's a lot of truth to those reviews. And, if they have enough of them that are good, that's what I gravitate towards is the doctors that have the good reviews. And it's, you have to do stuff up front before, and we moved to the other side of town, and it's not convenient to drive an hour and a half to go back to the doctor, but I'm keeping my primary care doctor because best doctor I've ever had in my life. And he listens to me and he pays attention to me, and he has his medical assistant call me and say, I haven't seen you. You need to come in, that kind of thing. Like, who does that? It's just kind of hard to believe. So when you find those rare individuals, you know, try, you need surgery. You don't have a doctor for orthopedic or whatever, I get on Facebook sometimes and say, "Hey, I'm having this problem, and I'm not sure who to go to and stuff like that." So, doing a little homework before we make healthcare decisions can um, pay with not having to have bad experiences. So, but Reverend Denise, welcome. We have been talking. My dogs are getting ready to bark because Christy's coming in. Hang on.
Craig's had his hand up for a while.
Okay, Craig, please. You're muted. You're muted. You're muted, Craig.
I went to the website for my insurance, and I don't know if you can see, but it's giving me gay and lesbian counseling. And you know, I didn't even go there when I found my provider that I started seeing yesterday, because I don't think I have a gay issue. I have
right.
I have a different issue, but so on my directory, I can find gay and lesbian friendly providers. And so, yeah, so it wouldn't be that difficult for me just because my provider directory is listing the people. That's all.
But your employer too is really tuned into the diverse communities that work with it. So is that
But
part
yeah,
of it?
working at CVS, there's a huge amount of gay and lesbian employees, and I mean, we're celebrated there. We have our own employee resource group with executive vice presidents at senior levels as sponsors of our employee resource group. We have like 10,000 members in our gay and lesbian employee resource group. So, yeah, I mean, I've been blessed that I've worked at a company for the last 30 years that's provided same-sex domestic partner coverage from day one. I started back in the 1990s when it was unheard of. So, I mean, the organization I work for is very supportive, but um, you know, like I said, I'm acting as my own primary care pretty much. And Monique and Mona, y'all are right. I have this magical thing called a cell phone, and I put all the prescription drugs that they want. Uh, if they want to give me a new one, I'll put it in my phone. Here's what I'm already on, and look for interactions and so forth. I mean, come to find, before I was going to even ask for an anti-anxiety drug, a drug that I'm already on, metoprolol, is sometimes used to treat anxiety because it slows the heart down, and it, uh, respiratory and all that. So, Monique, and I'm just at that point where, yeah, I have to do my own research because
Yeah, you do.
I think I work for myself now. We go for that. It seems like the care is really disconnected. I wish I could go to provider B, and provider B, when they pull up my name, they would have all the information of all the other providers I go to. It's just so disconnected and discombobulated.
Yeah.
Yeah.
And going to the hospital, like with an elderly family member, they're like, what medications do they take? Well, that family member had the forethought to write all their medications down on a piece of paper, which went to the ambulance driver, which went to the EMT, which went to the intake person at the hospital, which went to the medical assistant who took the notes, which went to the doctor. And it's like, that's a basic thing that why don't, especially for, people that you've seen before. I don't know. It does seem like it could be accessible, knowledge for, at least from a standpoint of the pharmacies, But what can we do? What is there something that you feel like we can do as a group and put in our resource portal that I'm building? Like if you've come across something with regard to medical care for the LGBTQ community, and maybe some things that, like we talked about with the the Houston Bar Association with medical directives and, stuff like that. All that stuff is so important just as people to have, but it gets complicated when, we add different things to it with regard to culture and gender identity and sexual identity and all the other things that, intersect with who we are as people. So we want to help work on discrimination bias. We want to help create training opportunities, or at least find out if the doctor we're seeing has had any diversity training or their staff. We want to stop having stigma and fear of telling our doctors we're, who we are. We want to stop the legal barriers, such as restrictions on same-sex marriage or adoption or gender-affirming care. Financial barriers, it says economic disparities within the LGBTQ community can result in limited access to affordable health care. So there's limited research and data. Historically, LGBTQ health issues have been under-researched, leading to limited evidence-based practices and guidelines for healthcare providers. So there's, mental health challenges, healthcare exclusion policies, geographical disparities, intersectional identities. All of those things are part of who we are, and being able to access the right kind of care and good care. So
Reverend Denise, you were about to say
what
something.
does Denise have to say? We've only got 8 minutes, and I need to hear Denise. I gotta run at 7:30, y'all.
Well, it sounds like you all have had a very lively discussion, and I'm glad to chime in. I do think it's really important that we talk to each other and share those doctors' names and places that we've had positive experiences, just like we would do any other thing, a restaurant or something like that. We tell our friends when we've had good food, so you tell your friends when you've had a good doctor. It does scare me if my doctor were to retire. I've had her, and this is my primary care, for at least 20 years, maybe a little longer, maybe 21, 22 years. And the thing that I like is that she's younger than me, so she may be around a while. But if she were to retire, it would be scary. Now, she did move her office from where we live. It was 10 minutes away. And now we drive 30 minutes away to go see her because it was important for us to maintain the same level of care that you described, Monique, when you talked about, a doctor who tries to get to know you. But this doctor's, known me for 20 plus years, and Joanne too. And so the other thing is that the educational piece is so important. There are a lot of policies that are enacted that are oftentimes are not favorable to the LGBTQ plus community. And so, it's so in terms of advocating for ourselves, we've got to also educate ourselves, because the insurance companies are driving a lot of the decisions that's happening right now. Is not just that individual doctors belief or perspective anymore. It's they need to make sure that they are going to get paid and compensating for their services. And so oftentimes it's a tough decision for them in terms of the decisions that they make and where they stand on issues. And then there's a lot of misinformation. And so, the education, the advocacy, and then the voting, making sure that we encourage our communities to get out and vote in a very informed and educated kind of way. But it is definitely a crisis kind of situation in healthcare. And the unfortunate thing is that our trans community and our gender non-conforming communities are unfortunately suffering the most. And so we've got to stay alert And then we've got to take action, and taking action means to educate ourselves, advocate for not just ourselves, but advocate for those who are our children, you know, particularly our trans children. It's really sad. You know, it trickles down not just in our educational institutions, I'm sorry, medical institutions, but even the educational institutions. There was an article just yesterday where the governor is planning to exclude teachers who identify as trans in the classroom. So, you know, it's a lot going on right now that we have to stay alert, and we can't allow ourselves to tire out.
I'm glad you mentioned the political aspect of it, because I don't like talking about politics and I don't like making anything political, but that's like the root for us right now with our healthcare, because it feels like we're under attack. So I posted that article on our Facebook yesterday about the gender nonconforming dress with teachers, and I'm just like mind blown with what's happening. I don't understand. So that's why we have these conversations. They're almost therapeutic for me,
I've been
because I
lucky
gotta make sense of
to
the
provide,
world. I gotta make sense of the world.
you know, if you just find a doctor is going to behave the way that their heart and soul tells them to behave. It doesn't matter what Governor Abbott is sitting up there on his high horse saying or not. You know, my providers are treating me well, and that's all, you know. And so if y'all need the name my cardiologist, I'll fork it over.
But you know, I mean, the political aspect is still huge, even if the doctor has their heart in the right place. I mean, you know, things like surgery, nobody can afford to pay for their own surgery, if their insurance doesn't cover it. So, like, say if gender affirming surgery, for example, or medications that you really need that are, you know, if those kind of things are not affordable to you, then, you know, the doctor's kind of fighting an uphill battle as well. So I think the political aspect is incredibly important, and it is really a shame how much insurance controls what we do, and the things that everybody's been saying about how the doctor doesn't, you know, go through the charts. I mean, this whole electronic health record system was supposed to solve a lot of that, and it has actually made it worse. It's made it so hard to find information about people's backgrounds and things like that. There's so much unnecessary stuff that you have to wade through to find the important information, that you know, if you're an employed physician, as so many of us are now, it's you know, how long you have to see a patient is dictated to you, and you have to sacrifice one for another. But some of us do still try to get around that, and I consider one of the perks of my job, into really hearing people's stories. I really love that aspect of it, and getting to know people personally. And I hope that there are other physicians like that. I really like what y'all have been saying about spreading the word and advocating for ourselves. I think it is incredibly important to speak up. Yeah. Her bad experience? Yeah, but that didn't have to do with gender or anything. But the trans community is particularly vulnerable and dependent on the medical community. Uh, just and so some of the trans groups that I've known really have their own resources for physicians and things, but and I don't even know always how to get on on those lists and things, but I think that we really need to look out for our for our trans friends, and it's especially in terms of medical care.
One other point I want to add to that point, Carol, is that when people, it affects people from taking a job out of the area where they live. Like if they want to move to a different state and they don't know anybody, they don't have the resources, particularly speaking specifically of the trans community, that's a big issue in the choices that they end up making to choose not to leave and take a job. Because I know friends personally who've struggled as a result of moving to a different area, moving to a different state.
It can change everything. So.
Absolutely, and in terms of insurance too, I know that I never thought I could leave Texas just because I thought I would lose all of Marco's benefits, and it took me a long time to figure out how I could leave the state. So that's I'm sorry, that was kind of an aside, but it's really a shame how that's covering everything. So the politics is incredibly important to fight for justice in all those areas.
I gotta get going, y'all.
Okay, we're going to end up tonight with a gratefulness in our hearts for the conversation that we had tonight, and the appreciation of all of the people here tonight who have opened their hearts to the subject of diversity in healthcare. And these God Talk sessions are reposted on YouTube so that others can discover the topics that we talk about. And again, we're going to be building a resource page for the online community, or for the community, that has information like this, the legal information, medical information, things like that. That's on my big wish list, my bucket list for Resurrection, to become a resource for in mind, body, and spirit, in every way. So God bless y'all. Thank you for coming tonight, and we'll see you next week. Take care.
Good.